Hello, my name's Alesia Stripeika. I'm going to first start my discussion by talking about the papers that we read and give a couple examples of how they impacted me. The first paper is a CDC paper, and it's based on a Cochrane research study on preventing occupational stress in health workers. And it focused in on 58 studies that are evidence-based, peer-reviewed. Two different types of stress interventions: personal directed intervention, such as cognitive behavioral training or mental physical relaxation. So those are that one. And then they also tested organizational changes, such as social support or work schedule changes. Both of these studies showed that there's moderate success with these interventions in reducing stress. So I found that kind of interesting. The second paper I read was based on a study done in 2010 by Health Psychology Research. And the focus of the study was coping strategies for stressful events, and it was done at a general hospital. There were over 200 participants, male and female, physicians, nurses at different education levels, ages from 21 to 58. They used a standardized questionnaire to evaluate people's responses of coping strategies for stressful events. And what I found interesting is that depending on where you work, the source of the stress, there's different types of stress. So for example, if you worked in the intensive care unit, you're going to deal with living life and death situations. So daily event stress, versus working on a med surg unit, it may be dealing with staffing issues like low staff to patient ratios. So, dealing with that kind of stress. The other interesting facet of the study was how men and women dealt with stress. So men tend to be more problem solvers, whereas women tend to be more spiritual, and they dealt with stress with spiritual needs, or they're more wishful type thinkers. So I thought that was interesting. But the takeaway from the study is that how you approach stress is how it's going to affect you. So if you approach it positively with self-care, you're more resilient that way. You seek social guidance, peer help. These types of things the stress is going to affect you not as harshly. So you will have less likely to get physical ailments from the stress and depression and things of that nature. So how you approach it. So that's a big takeaway I got from that. The other paper I read was from the Institutes for Health and Improvement, and it's the framework for inspiration, joy, and work, how to introduce joy into the workplace. And it went into the 4 basic steps that leaders can do to start this process. And the first step is leaders should ask their staff, what matters to you? And the second step is, what are the impediments to it? What are the pebbles in the shoe? And the paper stated that usually those 2 things are the foundation. They start first, and they usually happen together. And then the third is making joy a shared responsibility, shared government. So not only is it just for the leaders at the top, it's for the mid-level management, to all the staff, the nurses, the CNAs. And then the fourth is use improvement science to test joy. So those are some of the examples. So those are the papers I read. A couple of examples of how they affect me. The very first paper, right away, I thought, oh gosh, I deal with personal directed interventions. This last assignment taught me to look into ways to cope with stress, and I found a meditation app that I really enjoy. It's called Luminosity, and it really has helped me. And I deal with stress, and I use it every day. It's wonderful. It's taught me mindfulness and breathing exercises, and it's short and it's doable. It's something I do every morning, and it helps me reduce my stress level. So I find that really helps. The other example is continuing education. In the paper said that's a really good way to help reduce stress, is to get, be educated, do continuing education. And an example of that, Moab Regional Hospital, the other location where I work, we have a program called Relias, and it's an ongoing training program, and it encompasses such subjects as fire safety, HEPA, basic life support, advanced cardiac life support. Those are the big ones, and they're ongoing training sessions. And we have mannequins, a male, adult, child, and baby mannequins that we can practice CPR skills on, and breathing skills. It's amazing. So I had a nurse tell me the other day that she works on med surg, and the ER asked for her help, and she went over to help on a code, and she was so grateful. She goes, I was grateful I had this ongoing training. I could actually do CPR. I felt confident, and it reduced my stress level. So those are a couple of examples of how this affected me and how I could relate to these papers. Now, question 3, it talks about, look at the 4 steps, leaders, and in this model, is it realistic? And yes, I do. I think it's realistic, especially for a hospital setting like Moab Regional Hospital, because there you've got different tiers of management. You got the upper level, the CEO, the managers on the floor, so many different tiers. And yes, a model like that, I think, could be very effective. At the nursing home where we're really small, we have like 3 managers, and the rest of us are staff, so maybe parts of that model, so we kind of wing it. So I think we don't really have an organizational model. So going to question 4, it says, look at step number 3 and talk about the process system approach in the IHI framework for improving joy in the work. Discuss and give thoughts on the different models, such as the physical and psychosocial safety, meaning and purpose, choice, autonomy, recognition, participant, and camaraderie. And the ones I want to hone in on are the physical safety and autonomy. And I work full-time at the nursing home, so I'm going to focus on that. Our number one team goal is patient safety, is fall prevention. And our residents are, our goal is to have 0 falls, but of course that doesn't happen. They do fall as the residents get older or get sick, or their health changes, and if once they start falling, their risk for falls becomes exponential. It just escalates. So we're constantly modifying the care plan and doing daily huddles at our meetings, like, okay, how we're gonna approach this resident and help prevent them from falling. If they've already fallen, they're at higher risk. So that's one thing that we focus in on. The other thing is autonomy, and an example of that in work schedules. A few years ago, I used to work nights there. I worked 4 years straight of nights, and finally I just said, I've had enough. I'm getting too physically stressed from this. And I talked to my management and got in on working days again. And that reduced my stress level so much and brought joy to my work again. I got joy back in work because I'm back on days. It was amazing. So those are some examples. Going to question 5, it says, look at Appendix B and from the framework for improving joy. And I did that and give some examples. So I'm going back to the physical safety, fall prevention. A way that we can measure that success is having 0 falls. And there are ways that we track those falls and the types of falls. And like I said, we are constantly updating our care plans and modifying it to prevent falls. And that is our goal as a team. And it brings joy to us when our patients are safe and there's no falls. So that's it. Thank you.